One of the ones that comes to mind is Jessica. Jessica was about 13, maybe 14 when we first met. And she came to the office and she had an underbite. And her parents were aware, they were both present. They were aware of the bite problem. And so we went over treatment options and we came up with a plan. And we got started. She was a little reserved. I mean, she was a teenager, didn't say a whole lot. But as we got comfortable, got to know each other, her personality started to come out, open up a little. And then it came time for her jaw surgery. She needed jaw surgery in addition to the orthodontics. And her whole family just pulled together and we rallied around her. She came back after and her whole demeanor changed. And this was a few years ago, several years ago. And ever since then, she and her parents, they sent thank you notes, and that I have framed actually. And they have sent us continual pictures of her dances, and then graduation, and then so on and so forth. Every year we get a picture and a nice note. And it just reminds me of the impact that it had on her and her whole family. Her parents were truly grateful, and it was so much fun to go through that with her and watch her grow and blossom and just really open up and just shine. And so that was definitely one of them. We also had Chris, who was probably about 8, maybe 9 when he came in for the first time. And his mom was coming to check to see if he needed braces. And the more we talked, we discovered that there were some breathing problems. He was having trouble getting enough air, and he occasionally snored, and he was taking some ADHD medicine. And so we talked about airway and how orthodontic treatment can impact and improve airway. So after we widened out his palate so that he could have improved airway, he didn't snore anymore, and he was off his ADHD medicine. And the mom could not believe it. She really was blown away, and I feel like that's truly life-changing treatment.